My name is Drew Reynolds. Today we're going to talk about challenges facing behavioral health organizations and why some of the strongest organizations are still struggling to demonstrate impact and receive the funding they so need to continue and support their work. Now, many behavioral programs and ones that I've worked with are doing great, meaningful work in their communities. You're doing great work in your communities. You're reaching families, you're supporting prevention initiatives, you're addressing complex mental health challenges, you're providing access to services for individuals who need treatment. But when it comes time to demonstrate the impact of this work, you may feel maybe less confident than you would like in being able to do that, at least in a way that goes beyond the individual client stories that you know so well as you who are out there working in these programs, right? And it's not because your work is weak, and it's not because you're not having an impact, right? More often it's because the systems used to measure and communicate that impact have developed maybe gradually over time, but can still need some work. And so today, what I want to do is talk about some of the challenges that behavioral health program leaders are facing when they're trying to demonstrate impact in a really clear and important way. Now, one of the first challenges that I see when I work with organizations is that their reporting systems are pretty fragmented. You've got, a survey here, you've got a spreadsheet over here. You might be reporting something to a state database or a federal funder in one location, and they have a system that you put some of your data in. And then maybe you're collecting some information, honestly, when I've talked to some folks on Post-it notes, right? So it could be any of these things. And the challenge, of course, at first is that none of these systems are really talking to each other. And as a result, you're spending lots of time exporting data, moving data around, reformatting spreadsheets, and assembling information just to meet some of the requirements of your funders. And it's inefficient and it takes a ton of your time. And it might even be that if you feel less confident in using a tool like Excel or others, then that might actually be really hard for you to do it. And then you feel less confident and maybe you say, well, maybe I'll do what's required, but not beyond that. And over time, this fragmentation makes it really difficult to see kind of the full array and work of your impact. So that's a really big challenge, is that you've got these fragmented systems. A second one is that no one really owns it, right? Maybe you feel like your job is to own it. Maybe you have another staff member. If you supervise a few people, maybe you're kind of hoping that someone on your team would be able to, but maybe they don't have the skill set or the background to be able to do it well. And the challenge is that these evaluation responsibilities are spread across multiple people who are all doing different things and also likely engaging in delivering services and programs. So your program staff may collect information, partners maybe, if you have external partners, for example, like you might be relying on them to submit you data so that way that you would have the information and then report out. And you are having all these different systems in place and all these different people in place, but no single person clearly owns an entire evaluation system, or there's no kind of comprehensive strategy that brings all those things together, right? And the challenge is that leadership is going to come to you and say, hey, we need a report on X, Y, or Z thing. If you have a supervisor or leadership, maybe it's a county commission, maybe it's a public health director, something along those lines. Maybe you're a nonprofit executive director. But the challenge is that if no one's owning these data systems, it gets really hard to get that information into those leaders' hands so they can make effective decisions. And when ownership becomes really unclear, the data collection becomes inconsistent and reporting becomes more reactive rather than proactive. So that's the second challenge. So first challenge, right, was reporting systems are fragmented. Second one is nobody owns the data, right? Third point is you're measuring activities and things that you're doing, outputs, right, to show, but you're really struggling to show outcomes or show change in what happened. So a way to think about this is, you're able to count what you do, but you aren't able to demonstrate the results of what you do. So you might be able to say, hey, we served this many people came to some of our trainings and workshops, this many people participated in our evidence-based programs, this many people went to treatment, this number of people were reached in one of our communications campaigns. All awesome things. You always want to track those outputs and demonstrate and document the work that you're doing. But of course, the challenge is what's the result of that, right? The result of a communications campaign or an evidence-based program or going into treatment or any of these things that you're doing is that you're going to see some change as a result, some sort of some desired different outcome that you're able to empirically measure, and in most cases quantitatively, although there's good room for qualitative work on this as well. So the challenge is that these numbers are not readily available to you, And when it comes time to decision making, especially for those when they're people who are making decisions about funding, whether it's in your department or whether it's your grantors or state and federal funders, they're looking at, well, which one of these programs has really demonstrated change that we can measure, that we can see, that we can count on. Because when funding is difficult and tight, you want to be investing in those programs that are going to have the greatest impact. And so organizations that can't show those outcomes are running into huge challenges being able to sustain and maintain their funding and continue their good work. So that's the third one, is being able to show change and to demonstrate outcomes. The fourth is that you have a bunch of data, you've done some good data collection work, but now the challenge is that it's actually really hard to tell a good and meaningful story about it, right? So in many programs, the raw ingredients of demonstrating impact are already there. You're already got the numbers. You're gathering information, quantitative information on how many people you're serving. You might have some really good pre-post survey data that shows change over time. You might even have a control group and a randomized controlled trial if you're real fancy, right? You may be gathering feedback from participants qualitatively through focus groups or interviews. You may have amazing testimonial data or a beautiful video footage, right? All the things that you might see that comprise a great data set of data structure for your organization to be able to demonstrate impact. But then you have the challenge that they're all scattered in different places, and you haven't really told a cohesive story about it. What is the story that you want to tell that is the kind of narrative arc of your organization that weaves all this information together? So great, you're having an impact on changing youth lives and helping them to make healthy decisions. Maybe you're having a wonderful impact reaching out through peer support programs to individuals who have a history of substance use. Maybe you're working in housing and trying to get people connected to housing that they didn't have access to before. Those are all great things, but what is the broader story? What is it that you're trying to communicate to an audience about the impact of your work, of which these different things that you've just collected data on are pieces of evidence that support, right? You're building an evidence base to support a broader narrative about something that is, really impactful. And so that challenge is that you have the data or the information, but telling that story in a cohesive way, and then also being able to be able to take that data that you already have and make it digestible for the different audiences that you're facing. So to tell that story to a program grant officer at the federal level, to a county commissioner at the local level, to your number one donor who's also a member of your board, a different conversation, and to the broader community that you feel that you want to be engaging, as well as maybe the audience of people who receive services that you're providing. All of those are just very, very, very different constituencies, right? You could add community foundations in there as well, right? So with all those different constituencies, you have to give them different information because they're looking for different things. And what draws them into your mission is all different. Finding a cohesive story is really, really challenging. And so maybe that would be my number 4, one that I keep seeing a lot, is that this challenge around having the data but the story being difficult to tell. Now, the 5th one that I've got for you all today is leaders themselves, right? So leaders themselves are carrying too much of the reporting burden themselves. So as a program leader, your role, or an organization leader, right? Your role is much larger than just reporting on outcomes and reporting on outputs, right? You're managing partnerships, you're coordinating programs, you're establishing coalitions and helping them grow and flourish. You're hiring staff and managing your staff. You're working with community stakeholders. You're trying to get out and be a public face and be a thought leader on this particular issue in your community. All of these huge responsibilities. And yet you also feel like you're responsible for a bunch of the data sets that are trying to hold this whole thing together, and you just don't have time, right? So you feel responsible for holding an entire reporting and evaluation system together when you yet still have all these other responsibilities, which seem, and honestly in many cases might be, the more pressing need at the immediate, in the short term, right? So you find yourself spending far more time on spreadsheets and data than you ever expected. And for some of you, you're like, I didn't get into the work to do this. I teach evaluation courses in School of Social Work at Georgia State. And I know some of the students I talk to are like, look, this is really important and great, but I didn't get into social work to look at spreadsheets, right? It's important. It's an important skill to have, but it may not be the leader's primary responsibility. So, and it creates this kind of constant sense of being behind on reporting work and evaluation work, feeling like you're not getting the information that you need. And then you also don't have the data or infrastructure needed to make the decisions that you need to make and to be able to show the impact that ultimately leads to the funding that you need. So you've got this bottleneck. And a lot of times for leaders, it's you. You are the bottleneck. And for myself, I've had to tell myself this a few times as a business owner myself. Like sometimes I am the bottleneck. I am in the way of helping this project or this organization or my business for that matter to grow. And you need to find ways to then delegate some of that responsibility to other people to help you to be able to accomplish some of this impact work because it takes time and dedication and you don't always have it. So I'll review again. What are these 5 pain points we're talking about today? The first one, reporting systems are fragmented. Second one, nobody's owning the data. Third, you're measuring activities and outputs, but you're not measuring outcomes. Fourth, you have the data, but the story is really challenging and difficult to tell. And lastly, you're carrying just simply too much of the burden yourself and you need to delegate. So across these challenges, the issue is rarely lack of commitment or effort, right? You're committed to doing data. We're all committed to this, right? The reason you're listening to this podcast is because you have some interest in showing and demonstrating impact using data and evidence, right? So that's not the issue. It's not lack of commitment. It's not lack of effort. You're probably working like crazy right now. I know I am. So I bet you are too. And the challenge is it's not effort. It's not lack of commitment. It's not lack of caring. But the challenge, I think, comes to really being strategic and missing that strategy piece and maybe feeling a little bit misaligned in terms of who's doing what in your organization and building in the processes necessary to communicate and demonstrate your impact more effectively. So your strategy, your measurement systems and reporting processes, they may have all developed, maybe it was before your time, maybe they kind of came up organically, maybe it wasn't as strategic as you're putting it together. And the idea is that you really want to find some alignment on these so that you can then use them in meaningful ways to demonstrate impact. Now, I want to be clear here. The goal here is not to say you need to work harder on this, because the reality is for many of you, you probably don't have the time or ability to do that. It's more along the lines of how can you use a strategic approach within your organization to build this capacity. And in some cases, that might mean bringing on additional help in some capacity. But in other cases, it might really just simply be getting really streamlined and organized in the work that you're doing to make it more repetitive, easy, and better, more efficient. And I think that can be a real opportunity of winning, I think, in your organization, is to get these processes really effective and efficient so that you're not spending hours and hours in manual labor trying to go through spreadsheets, but rather you're seeing dashboards and materials presented for you in a really straightforward and systematic way that can allow you to do the work you need to do. Now, to help leaders to think about some of these questions a bit more systematically, I have recently developed a short diagnostic tool called the Clarity, Impact, and Funding Resilience Scorecard. It's an assessment. It takes about 5 to 10 minutes and helps you to evaluate how aligned your program currently is across 3 key areas, and that's clarity, impact, and funding. And for those of you who've been listening to this podcast, I talk about clarity, impact, and funding all the time. It's the framework I use and the methodology I use when I work with my clients. And this scorecard was designed specifically for behavioral health leaders, so folks who are doing mental health work, substance use work, who receive state and federal funding, to be able to use this clarity, impact, funding framework and to go through this assessment and really figure out what it is that their organization needs to work on first to kind of level up, as it were, when it comes to their impact. Now, the goal of the scorecard is not to judge your program. It's just simply to sit back and to see where your systems may be strong and where alignment can be improved. So to access this scorecard, what you want to do is go to commongooddata.scoreapp.com. Again, that's commongooddata.scoreapp.com. And if you go to commongooddata.scoreapp.com, you can take this free assessment. It's going to send you a personalized report that will walk through some of the ways that you can focus your attention in your organization on what needs to be improved. So that can hopefully give you the clarity that you need to go out and collect the information and evidence you need to demonstrate your impact and ultimately receive the funding that your organization needs and deserves to continue the great work that you're doing. So again, go to commongooddata.scoreapp.com to take that assessment. So I hope that this is a useful assessment for you. Hopefully, if you've experienced some of these challenges that we talked about, that the Score app can be helpful. or the scorecard can be helpful for you to work through. And kind of designed with you in mind. So I hope it's a helpful resource. Check it out and would love to hear your feedback on it. So if you want to, go to my website or find me on LinkedIn, and would love to hear about your experience taking the scorecard. Anyways, hope you all are having a great week. Thanks so much for your time, and good luck with all the great work that you continue to do in your organizations.